Thanks, Steve. I likewise was in clinic yesterday, so I'm sorry that I missed the conversation that you all had yesterday, and may tap on a few themes here that were covered yesterday, but I think that's kind of part of the idea here. What I wanted to talk a little bit about was, I know you had a session yesterday on the impact of technology and how technology has been changing the way we deliver health care, and how that has an impact on workflow, creating workarounds, the perception of workload amongst providers who are delivering care. And I think a lot of times that discussion is very focused on the impact of the electronic health record, and it's very focused on the provider's experience of care. I think that the change that our healthcare systems are feeling is equally being driven by a digital transformation in society at large, and the expectation of consumers that they can receive care in a way that's convenient to them. And the VA may have some valuable experience here. It's been well over a decade, more than 15 years, that we have been working hard to leverage technology to deliver care virtually to patients where they are in the context of their daily lives. When I started in the VA 16 years ago, this was something that was kind of a pilot, something interesting to try, something novel, something that, we'll do a little bit of telehealth. Maybe we should let patients look at their records online. And now, where are we in the VA? Well, this is actually now one of our absolute mission-critical priorities. And in fact, I would argue that our healthcare system is now looking at face-to-face care, care that we work in the community, and our virtual care, all as sort of equal players within how we deliver healthcare. Where are we right now with connected care? What do we define connected care? Connected care, this is our vision statement here, is that access and the veteran's experience would be enhanced through information and communication technologies that are effectively integrated into the daily lives of veterans and VA staff. And the technologies are nothing shocking. It's our portal, our personal health portal, My Healthy Vet. We have over 4 million users in our portal, more than 2.4 million who are regularly using the premium features on the portal. As an example, since 2005, we've processed 106 million prescription refills online. We're doing over 1 million visits per month by electronic messaging, secure messaging on the portal. Have had more than 1.8 million veterans download their medical information, their personal medical information through the blue button. Mobile health applications. Our telehealth program, last year we did more than 2 million telehealth visits. Over 12% of veterans who received some care in the VA last year received a portion of their care by telehealth. That's either by video telehealth, store and forward telehealth, or remote monitoring in their home. And we're doing quite a bit in this space, and I think this is driving in some ways significant change and frankly some workarounds and changes in our workflow. I want to sort of step back a little bit to sort of how I think about what our vision statement here says. And it's really, in my mind, that technology is allowing us to provide access to really what I think are the two most important products in healthcare that consumers come for. And that is access to the trusted relationships with their healthcare team, and then access to trusted, vetted, valuable health information, including their own personal healthcare data. And they want that access to occur increasingly in a way that improves their care experience. And I think all of us who have been patients recognize that the experience of receiving healthcare, of getting access to your information and getting access to your trusted relationships, is not always ideal. We all have had the experience of walking to the sub basement of some hospital to try to fill out a form and pay 35 cents a page to get our medical records printed for us. It's not an optimal experience. And I think that the adoption of connected care, in many ways, portals, mHealth apps, telehealth, what's driving that adoption is that patients are realizing that in many ways these technology interventions are the most awesome workaround ever for overcoming broken healthcare systems. That this is reducing the barrier for them to access their healthcare provider, to access their own healthcare information, to become more educated consumers and better self-manage their care. And because patients are discovering, we've seen this in the VA, that they're discovering that when I get an account on the portal, I can start to have power to manage my own health care. It's actually the patient's discovery of what they view as a workaround that's changing workflows within the clinical environment. And it's forcing providers like me, who when I started 16 years ago, just came to work and saw patients, and then went home, to spend last night from 11 to midnight answering secure emails and actually delivering clinical care because I had to get that done before my messages escalated, and I got yelled at in the middle of this session. Anyway, which gets to the performance measure side of things, right? So I just put up some examples here. I like to divide what I think, the way we think about how technology is impacting care into 4 buckets. First is simplified transactions. And this is a win-win. Simplified transactions are almost always a win for both sides of the house, the patient and the provider. If I can get my online prescription refill done without having to talk to anyone, if I can book an appointment through online scheduling, if I can get reminders, everyone wins in that setting. The second category are digital tools that improve the quality of communication. I mentioned in secure messaging we're doing more than 1 million visits per month. These are direct visits. This is really convenient, but it's completely changed and completely changes the experience of providers. And there's been a lot of, and we can talk in the discussion a little bit about what we've learned about how that's changed the conversation within healthcare, and it's changed the daily life of clinicians within the VA. The third category is access to clinical data, and this goes in both directions. This is the ability for veterans to see their own health information, including their progress notes. That's been transformative for us in the VA, for veterans to be able to read their clinical progress notes through the Open Notes initiative, but also for veterans to share their personal health data or patient-generated health data with the team. And then the third area is actually in the delivery of healthcare through technology. And I thought I would just share a little bit briefly about our telehealth program before I hand things over to Leo. Because I think this is a strategy that we have chosen to use within the VA to enhance, and I like to think about our telehealth program in 3 ways. How does it improve accessibility or access to care? We mentioned that. But also in the context of increasing workload and the challenges of changing workflows, how can telehealth for large integrated, in our case, national healthcare systems, start to change the question of how we hire sufficient capacity from the perspective of healthcare providers? How do we, can technology help us with our capacity problems on the provider side? And what is the impact on quality? And then how does all of this would be interesting for a discussion, how does this all impact the experience of care, both for veterans and providers? We deliver care in, our telehealth program occurs, I like to divide it into 2 categories. Where does it occur? It occurs, we've done a tremendous amount of clinic-to-clinic telehealth, particularly video telehealth, connecting in more than 50 clinical specialties, patients at a remote clinic to a provider at one of our main medical centers. But we're really increasingly targeting delivering care into the home through telehealth, through video visits, through secure emails, through scheduled telephone visits, through mobile applications that allow for remote home monitoring, et cetera. And then also in the hospital, for example, through tele-ICU. But most importantly, I think, is this second second row there, how we implement telehealth, we think about this, that telehealth really should be, is increasingly becoming part of routine operations. And this, I guess, is where I think that there's some interesting things that we could think about from a workflow perspective. We've moved from the expectation that care occurs in the clinic, and we're increasingly moving to the fact that care occurs both in the clinic and virtually through technology. And how does that change what the patient's experience is, and how does that change also the provider experience of delivering care? As we think about workflows, what portion of care needs to be face-to-face? What portion of a post-operative course, for example, could occur virtually in the home? Then from we implement telehealth regionally. We've stood up over the last year 11 telemental health hubs, 8 teleprimary care hubs. We're working on telesleep hubs. We've started to realize that we have gaps in face-to-face staffing that we just cannot avoid. Folks leave for another job. We have maternity leaves, people get ill, and in some of our remote clinics it can be very hard to fill those gaps, but we can use telehealth to fill those gaps within a couple weeks. We can have somebody delivering mental health care to a clinic where we had an unanticipated loss of a provider. And at the national level, we can actually start to match, and this is where telehealth can be a quality improvement initiative. We can start to match veterans in any location with the national specialist within the VA system for their particular condition. And that's changing the way care is delivering and creating new workflows. So that's just sort of a high-level introduction just of some thoughts that could be discussed in the